Hospitals across the country are running out of protective masks, gloves, and shields, and that puts doctors and nurses at risk of getting sick. But the solution to the problem may be just 3 hours away. KCTV5's Joe Chiodo shows how a hospital in Omaha, Nebraska is doing more with less.
Personal protective equipment, or PPE, like these N95 face masks, are in big demand. Now, I have one because we're getting construction done on our house and one of the workers wears one. That's common, but hospitals are running out now in the midst of this pandemic. Tonight, we're learning that light may be the key to keeping up with that demand.
If a picture's worth 1,000 words, these pictures say a lot about the dangers healthcare workers currently face. In this room at the University of Nebraska Medical Center, masks are being disinfected with ultraviolet light. That way they can be reworn. It's something medical professionals never thought they'd see.
In normal times, these N95 respirators are used once and then discarded, and we just don't have that luxury right now.
The masks are hung on clotheslines, surrounded by a purple haze. The situation shining a light on the desperate fight against COVID-19. Dr. John Lowe, a researcher with Nebraska Med, was part of the team that came up with the idea after realizing they'd soon run out of protective equipment.
Just like UV light isn't great for our skin, right? It can cause skin cancer and sunburns. The UV light disrupts the DNA, the RNA of the virus and inactivates the virus so that it can't infect anyone else.
Hospitals from coast to coast quickly began using the same technique. Staff at a New York City hospital are protesting their lack of equipment. Dr. Lowe hopes it can help facilities in need.
We need this to keep our staff safe, our patients safe. If we get sick, our patients will get sick.
I asked University of Kansas health doctors if they're on board.
We are looking into all of those things, different ways to reuse.
Right now, their first line of defense is canceling elective surgeries so they don't waste the face masks.
It allows us to make sure we have enough of that equipment for what we believe will be the surge.
That surge could come this week or next. St. Luke's Hospital tells me they're also interested in the ultraviolet light. Just like the virus is universal, the creativity is as well. In Madrid, Spain, researchers are taking a dive into something even more unique: scuba masks.
This one, I think it was a little bit crazy, but it was true that we were all very concerned. So we had to evaluate all the crazy ideas.
By replacing the snorkel with a medical-grade filter and 3D printed tube, it becomes a face mask. It could last up to 5 days. And we spoke with a doctor in Italy who's gone to even scarier lengths. She has been forced to boil masks, then iron them and spray them with alcohol. Each of these ideas, an unprecedented move in the medical community, proving healthcare workers aren't giving up, but instead finding light in the darkest times. Joe Chiodo, KCTV5 News.
And you know, it's not just hospitals that are running low on this kind of equipment. Police, firefighters, and other first responders, well, they need to be protected just as well. The state of Missouri has placed an order for more than 6 million surgical masks, 5 million gloves, 900,000 face shields, and 441,000 bottles of hand sanitizer.